Okay, thank you.
Switch off mic.
Okay, thank you. Thank you, Keith. And just to introduce myself, because actually I don't think I would know many people, because I'm a senior primary care facilitator for the clinical effectiveness group. My patch really is City and Hackney, and I am very pleased, however, to say that we have got Ranjan, who will be helping us look at your SystmOne clinical system. I am not that familiar with SystmOne. I do use, I'm more familiar with EMIS, but as I said, we're very pleased to have Ranjan, and Ranjan has very kindly stepped in at the last minute. The other person has sadly was unwell, so but you know, we'll give Ranjan all the support she needs when she's showing the SystmOne searches. So I'm going to just share my screen. Give me a minute while I share my screen, and I just want to make sure that everybody can see my screen. It should have a very kind of bright picture up at the moment. COVID-19 vaccination program. Can you someone just say you can see it, Keith,
Yeah,
or someone?
we can see it, Jo.
You can see it. Brilliant. Okay. Okay, moving on to the next slide. So what are we going to cover in this session? We're going to look at eligibility, the cohorts for the vaccination program. We're going to demonstrate the searches that CEG have written for you, the call and recall searches. We're going to discuss patient hesitancy and deferrals for the immunization program and show you the template we have built to help you with this. We're going to have a little bit of a discussion around understanding data flows between systems. And if you may well know a little bit more about this than I do, so if you do, please at the end, feel free to add any comments on this. We are going to look at how you can see how well you're actually doing using searches, actions that you need to do, a word about ethnicity recording, and I've got a slide on frequently asked questions because we've done a couple of these webinars now and some questions have come up. So we're just going to answer or I'll show you what sort of questions have come up already. But as Keith said, if you do have any questions, please, you can put them in the chat as we go along, or at the end, you can unmute yourselves and ask any questions then. Okay, so who is eligible and in which order? You're probably all very familiar with the 9 priority cohorts, but I think it's always helpful just to go over them again, just to make sure that we are all super clear about it. So the objectives of the immunization program are to protect those who are at highest risk from serious illness or death. And the Joint Committee of Vaccination and Immunizations, which are listed in the Green Book, they set out the prioritization for persons at risk. Those over age 65 have the highest risk, and risk, as we know, increases with age. And we also know that residents in care homes for the older adults were disproportionately affected by this virus. So just to quickly go through the priority groups. So priority 1, residents in care home for older adults and staff working in care home for older adults. Priority 2, those 80 years of age and over, and also frontline health and social care workers. Cohort 3, 75 years of age of over. 4, 70 years of age and over, or clinically extremely vulnerable individuals, but not including those under 16 years of age. So clinically extremely vulnerable individuals, these are the patients who have been coded as very high risk of severe illness from coronavirus, or another term was your shielded list, shielded category. Going down, 65 years of age and over, cohort 6, adults aged 16 to 65 years who are in an at-risk group. I'm going to cover that a little bit more when we actually get on and look at the searches, so that we're all very clear about who's coming up in this group. And then the last 3 are 60 years of age and over, 55 years and 50 years. I'm going to talk a little bit about some of the issues identifying who is eligible. The first issue was around the health and social care workers. You can remember this was cohort 2. So there are coding issues with this group, and what that meant was that when we kind of looked at the clinical system, patients had been coded with an occupation code, for example, might have been coded as an optician. And on further investigation, what we were finding was actually the person wasn't actually occupation optician, but a document had come back when they had seen an optician, and then that was coded as optician. So we did not include the health and social care workers in our searches. The other point about this was actually it's the employer's responsibility, not the practices, to call patients in for vaccination. So kind of two reasons really why we didn't include them. Care homes, there were coding issues around care homes, and we did ask practices actually to go through their care home registers to make sure that the patients who were coming up in their care homes were indeed patients who were in a care home, and if somebody came up who was no longer in a care home, we were asking practices to put on a code that said no longer in a care home, which would mean that they wouldn't show up in that cohort, but would show up in one of the later cohorts. As I said, going back to cohort 4, which was the 70 plus or clinically extremely vulnerable, these patients are quite easily identified as they've been coded as in the high risk category for developing complications. As I mentioned earlier, it's the very high risk of severe illness from coronavirus code. Cohort 6, the 16 to 65-year-olds in an at-risk group. Until very recently, there were no business rules to this, so it was open to interpretation, and CEG adopted a flu plus model based on the green narrative to identify these patients for call and recall. We've updated actually those searches to new rules because some business rules have in fact come out. So we've now used those new rules. Okay, I'm just moving on. So this is just a screenshot of what you will see for your searches in your SystmOne clinical system. And I'm going to hand over now to Ranjan, because Ranjan will actually open her SystmOne so we can actually see them kind of live where these searches are. So I'm going to stop sharing. And I'm going to hand over to Ranjan to share her screen.
Not allowing me to share my screen.
Okay, so Charlotte, you just need to go back into the permissions and just add Ranjan to the sharing availability, please.
Do that right now.
Thank you.
Sorry, I'm still struggling.
Don't worry, just take your time because it'll just.
It's not letting me share still. Okay, yeah.
Perfect, thank you.
Great.
Thank you, Ranjan. So I'm going to, Ranjan's going to share the screen, but I'm actually going to talk you through it. So in SystmOne, you can see that it's called COVID First Vaccination Call and Recall, and it's version 8.1. So you've got all the searches listed in there, and they're all, as you can see by the numbers, they relate to those cohorts that I was describing. I'm going to describe some of these searches just so that we're crystal kind of clear what these searches are actually doing. So if we went down to cohort 2, for example, these are your aged 80 years old and over. They're excluding the older adults resident in a care home. They're also excluding people who've been vaccinated, people who have declined, and people who have contraindicated, because these are the people that you're wanting to use for your call and recall searches. They've also excluded your housebound, because your housebound, you will not be inviting them in. You will be going out to see your housebound. And just a point to remember about your housebound is that when you do the vaccination for your housebound, you're paid another £10 on top of your item of service for your housebound patients. But we need to make sure that the housebound are coded accurately, because as I said, it's the tightness of searches really to identify the correct people who are coming in. And there's codes, no longer housebound, that you'd be able to put on a patient's record if they were no longer housebound and if they were able to come into the practice. There's a little search underneath, patients without mobile number recorded. And this really is just so that when you're doing your lists, that you would identify those who haven't got mobile number recorded, so that they wouldn't show up, or these would be the patients that you would need to identify to do like a telephone call or landline. Moving down, just Ranjan, maybe if we can just look at the cohort 4A, because it might be good to explain what's happening here. So with the 4A, we've split cohort 4, if you remember, was your 70 to 74-year-olds, or patients who are on the clinically extremely vulnerable list, the shielded list. What we were asked to do was we were asked to split that into two searches for recall, your 70 to 74-year-olds, and then as you can see 4B is your clinically extremely vulnerable, or your high, or the other word is your shielding or high risk group. You can see that that cohort is aged, I think I can only just see this, but it is 18 to 69. We've split it further down into 4C, again cohort 4, but we're 4C, which is your age 16 to 17. And the reason that we've done that is because AstraZeneca, the Oxford vaccine, is not licensed for your 16 to 17-year-olds. It's the Pfizer one. So you would need to call them in when there's the Pfizer vaccination applicable for them. Remember that the cohorts and these searches will exclude the cohort that's gone before. So they're mutually exclusive. If we go down, 5 cohorts fine, because that's based on age. The next slightly more tricky one, I think, is the cohort 6, which is the at-risk group, the patients who are at risk, aged 18 to 64. In this group, what we've done underneath, if you see the search underneath, is that we've excluded housebound, and we've also excluded pregnant, not from the actual cohort itself, but from the recall searches of who you're going to invite. You will see just underneath at 6A2, the adult pregnant cohort. So we are not excluding people who are pregnant from the cohort, but we were just excluding them from your first recall list because it was felt by practice and feedback that pregnancy coding is not always completely accurate. An example could be that somebody was pregnant and sadly they miscarried, and yet the code for miscarriage has not been put on their record, so they're still coming up at pregnancy as pregnant. So there needed to be a bit of tidying up of the search before calling those patients in. Also, some practices said that they wanted to have a little bit more of a discussion with the patients who were pregnant before they were coding them in. So they were doing a slightly different pathway for those patients. So that is why we have them split up like that. Again, we're splitting the at-risk group up. Sorry, Ranjan, it's down. Yeah, that one, that's perfect. Again, on age, because of the reason I said earlier about the Oxford vaccination. And again, in case you've got some teens who are pregnant in there, we've split into the teens pregnant cohort. And then the other recall searches are just the later ones for age. So those are your recall searches, and I hope that's clear. Ranjan, can you open that folder in same core recall, but is there other stuff in that folder to open?
No.
So that's everything in that folder, is it?
Yes.
Okay. If we look at the other folder, which is the performance folder. The performance folder really relates more to the dashboards that CEG will be producing, and the dashboards are reflecting your actual activity. So these searches are not for recall and call. They are just so that you can see how much you have done. And so if we looked at, again, not the older adults resident in a care home, because they've presumably not been invited because you go and see them, but let's look at the other group, aged 80 and over. So how these are working is you've got your cohort in cohort 1, the whole cohort. So in this practice, there's about 922 patients, I think I can see. Then when you go down to the next one, invited, these are patients who have been invited but have not vaccinated or declined or allergy or contraindication. Next one, patients who have actually been vaccinated, so 768. The reason why I'd said the first one is it's probably likely that, you know, all 768 of them, well, were invited, but we're just showing you to say you've had 768 who've been vaccinated, and actually there's 2 patients who look like they've been invited, but they've not been vaccinated, they've not declined, they've no allergies, there's no contraindications. So you get an idea a little bit of what you're doing. And it's the same with the declined. If we looked at the declined, that is people who have declined and who have not subsequently gone on to be vaccinated. If I was somebody who a month ago declined, then you phoned me up again, and then I said, yes, I want to get vaccinated, I would not show up in this group because I've been vaccinated. So you're very clear about how many you've been vaccinated. Ranjan, can I go to the next search underneath, the PHE aligned conditions? When we were talking about cohort 6, and I said there's a number of at-risk groups that have been highlighted by the Green Book. The at-risk groups are all the patients that you are seeing coming up in these with these conditions. So that's what the searches have been based on, things like diabetes, chronic respiratory disease, chronic heart disease. So they're all in there. Ranjan, can we just have a quick look at the next one? In this little folder there, this is just showing you overall, without splitting into the cohorts, but overall, how many patients in your practice have been invited and how many patients who have received the COVID vaccination dose. So that is your overall picture of this. And I think that is all the searches that, you know, I can show you from the SystmOne. Have I missed anything, Ranjan? As I said, you're slightly more familiar with this than,
no,
yeah?
That's fine.
Yep, so that's all fine. Okay, so Ranjan, if you want to stop sharing, thank you so much for your help on that. And then I'm going to come back in and I'm going to share the presentation again. Let me just make sure that this comes up okay. Okay. You might be thinking or asking the questions, you know, why should I use the CEG searches and not my own SystmOne searches? And what we'd kind of like to point out with the CEG searches is that we design them with the needs of our local patients or the local feds and CCGs in mind. So as I said, there was the request to, for example, to split up the 70-year-olds and the clinically extremely vulnerable. There was the request to actually say, but we want to look at our patients who are pregnant, and so we did that separate search. Or there was the request to say we want to look at our 16 to 70-year-olds. So again, we did that local search. So that's how we were designing our searches. Our searches also avoided the occupation data errors. My understanding is that in the system searches that occupation had been included in as well, and so was bringing in a lot of patients. And as I said, it was the responsibility of the employers, not the practices, to call them in. So we decided not to include them. I think I've covered that, saying we didn't exclude the pregnant women from recall. And provides, our searches do provide the files that you need for your AccuBook. And then when you're sending your AccuBook invites, that should be coded in your system that you're sent an invitation. We are responsive to changing parameters. Guidance has changed, it's changed quite rapidly. And we can be responsive to that and get searches out to practices rapidly in line with the changing parameters. Okay, managing hesitancy and deferral. Through Pinnacle, if a person declines or defers, that will be coded in the patient record, and there is, you might see sometimes with aligned to that code is a little bit of associated text, because when people decline through that system, they can choose a reason for why they're declining. What we've built for practices is we've built a new CG template to facilitate the process of recording decliners and defers for those group of patients that you have either sent a letter to or phoning by landline, i.e. patients who haven't got a mobile phone number. So you have in your system this, I think it's called COVID invite in SystmOne template. And in this template, this is just a screenshot of it here, you can code a number of things. Firstly, you can code that you've sent an invitation to that person. So let's just say I'm phoning somebody up. They haven't got a mobile, but I've got their landline, so that you can go into that template and you can code invitation. What we're asking you to do is that when you do code that, you write some text to indicate that the mode of contact was via landline. And the reason I'm saying this is because there is only one invitation code, and that one invitation code for the COVID vaccination is called SMS text. And what practices have said is that they needed to have a little bit more detail, because just putting SMS text would not be quite accurate if they were sending out either a letter or telephoned them by landline. So that is why you need to add a little bit more information for audit purposes. For your patients who defer, so a patient might defer because they're unwell, they're hesitant, or they want to talk to some member of the family about it further. So what we're suggesting for practices to do is to say they've declined the vaccination, and then also you can code a little bit of text about this, and then you can also indicate by using this code treatment delay, patient choice. So we'll be able to write a search for you that would pick up patients who have deferred. It's the same for first vaccination as it is for second vaccination as well. We put a little bit of information just as a reminder, really, to say that if somebody defers, remember to signpost them, advise them how to book if they change their mind, and advise the appointment will be offered again in some time in the future. Section 3 of the template, it was agreed that if you had tried to contact somebody 3 times and had no response, that you would be able to put in that the patient declined, again with a little bit of text. So what you need to think about with this one is that you need to make sure that you have record that you have attempted to invite the patient, i.e. using that code at the beginning I talked about, and you need to put that in when you've tried to contact the patient. It's also been said to be good practice, actually, that one of the attempts is actually you have tried to phone them by landline. It's not really quite enough just to or you've actually tried to phone them. It's not quite enough just to have sent out 3 texts and then decline. There needed to be a little bit more proactive about trying to phone the person up. But once you've done the 3, then you can record them as having declined. And then at the end of the template, it's section 4, it's not showing here, but it's the simplest one really, that if you had somebody who truly declined the whole immunization course, you would, there's a little box that says, has declined the full program, and then you can decline them using that code. So hopefully this should make that process much easier for you. Just to explain a little bit about the data flows between systems, just so that there's some understanding about why there might be delays in some of the information. You might be being sent out from maybe your CCGs or your federation about how you're getting on in practice, and you might think, well, I'm sure we've vaccinated more patients than that is showing. So if you look at what's actually happening, you've got your point of care, your vaccination site. So then you've got by the hospital. Some people could be getting vaccinated, and that's your National Immunisation Vaccination System, or what they call the NIMS, and that is all collected in the data processing service, and then that will come into your SystmOne. SystmOne seems to be quicker actually than the rest of the clinical systems in getting information back from Pinnacle into your own clinical system. You'll probably know a bit more than I do that that is actually happening. And then, of course, you've got whether the person's been vaccinated in a hub or in pharmacy, which goes into Pinnacle, otherwise known as Outcomes for Health. That again goes into the data processing service and again comes into your system. So again, 24 hours later. With your care homes, I'm not sure quite, how practices are recording care homes, but I'm guessing it could either be by manually you're putting some information in, or you're using a laptop. But again, that information needs to get into Pinnacle and then data processing and back onto your clinical system to find out what's happening. Invitations, slightly more tricky, and actually, although we've tried to find out a little bit about how things work, you can see that we've got a couple of these ovals, in fact, that have got lines, which is meaning we're not too sure. So if anybody has information to give us, it would be very grateful on that in kind of clarifying the process. But we know that people are receiving either national letters or SMS texts about being vaccinated. GP Feds, the GP Fed or GP practices will be sending out invitations via Accurix. If sending invitations via Accurix, there should be the code that says patient has been invited by text, which is automatically coded in the patient's record. If, as I said earlier, you're sending out a letter or you're calling on the landline, then use the template, make sure it's coded, and then that will show up in your clinical system, your SystmOne. There may be, as this is very hazy, this little bit about patients being called via the CCG or public health. And at the moment, we're not sure how the invitations would come back onto your system or whether they do or not. So, we just need to be a little bit aware of that one. This was a search really to show how well are you doing. And this, I demonstrated these searches. They're under the performance folder. Just keep in your head, they're not the recall or call ones. The recall or call ones are the searches that you run again and again to see who's coming up and who you need to call in. These are actually just looking at your performance. How are you doing with the vaccination program? And you can see it all broken down by your cohorts. What do you need to do now? I'd suggest really that you do look at your care home register. I mean, you might have done them all, but make sure that is a tidy register. You can check your cohort 6. This is the one that the business rules have just come out. So we rapidly turned around a new version 8.1. But if you spot people who are coming up who you think, why on earth are they there, or something doesn't feel quite right, please tell us. We're working with you to get these, the versions up to date and everything. So please tell us. Your housebound register, as I said, if somebody isn't housebound, you will need to put in the code no longer housebound so that they do appear in the following cohort, the applicable cohort. And that's the same for point 4 actually. And it might be that you check who's not got an invite on their record. And just make sure that you do code invites. And as I said in the template, you can go back retrospectively if you haven't put that in and code that. Just a quick flag about ethnicity. We at CEG are very keen that ethnicity recording in practice is kept up to date and is accurate. And we've done a lot of work over the years really with getting ethnicity recorded. Remember actually that ethnicity is something that's self-reported. It's not something that you would add. It's the person saying, yes, I'm, whatever ethnic group that they are. It would be a self-reported group. It has come out that people, Black Caribbean, strong predictor of vaccine hesitancy. And, by having this kind of information in the person's record, it means that we're, more data intelligence is coming out, and then it informs new services and new programs. So I suppose it's really just a plug to say that on our templates, we have ethnicity as a page. So please encourage your clinicians to enter ethnicity if it's missing from the patient's record. Just a few frequently asked questions. How do we handle 16 to 17-year-olds who are at risk? Well, as I've said, we've got the searches there, so you'll be able to identify those. What about pregnant women? As I said, we've split that search, so you'll have a search that tells you who the pregnant women are, so you can check their records, but also it might be that they would require a phone call. Why does my CCG say my achievement is lower than I know it is? This, as I said, could be due to the delay of information coming back. Who can I contact if I don't understand how to use the searches? We have a team of people who can help you in Barkinghaven and Redbridge, and I'm sure most of you know them. There's Billy, Joe, Tracy, and Jane as well. So if you're struggling, please don't struggle and call us so that we can help you.
And sorry, and Faye, don't forget Faye.
Faye, sorry.
This is a SystmOne one, not BHR, so it includes Faye.
Oh, is it? Sorry.
Waltham Forest as well.
Yeah, I'm Waltham Forest with Faye. Why have I got younger patients vaccinated if I've not called them? This could be because of an occupation code, so they may well have had a vaccination because of the occupation code. How can I record telephone, letter, verbal, email, invites? I've shown you that you can do that via the template. So I think that is the end of mine. I apologise for people who are from Waltham Forest if I've mentioned BHR all the way through. So obviously we want to help you as well. So I'm going to stop the presentation and then come back and see if there's any questions or.
There are some questions in the chat, Joe.
Okay. Where's the chat? Let me see if I see them.
So Karishma has asked about the CSV file upload for AccuBook does not include mobile phone. Arinta from Broadway's responded, you need to select mobile telephone. Now, I think this is an issue that we came across last week, and in fact, I think it was, Faye and I were in the Broadway surgery with Mohammed, and we encountered this issue. And I think the solution is that you need to use the preset report, the default report. So that should be terminology that's clear to SystmOne users. Is that right?
I think we'd have to have maybe some SystmOne users who could answer that question.
My question was to SystmOne users, if that sounds the sensible terminology. So Faye, yep, can I hear someone?
When I'm saving it under CSV, I actually changed the heading manually to say mobile telephone, and then it easily goes through onto AccuBook.
Is that Arinta?
Yeah, it is. Yeah.
Yeah. So there is a solution in there. I think you do, but you just need to change, as I say, the settings and pick mobile telephone number up. So Karishma, if you've got any further issues, just contact one of us and we'll go through that process. We've got a question here from I think it's Dr. Kazi from Handsworth. Where exactly is the hesitancy template? Now, what's the equivalent of resource publisher and SystmOne? Do we know? Ranjan, maybe?
Ranjan, do you know?
Yeah, I'm just gonna.
Can you bring it up live on the screen?
Yeah. This is the only template that I'm aware of.
That's it?
That's it.
So there you go. So that's available to all SystmOne users. Exactly the same as Joe's described it.
Yeah, as I said at the bottom, there is the declined one there as well. So.
And then I've got some questions in the pre-submitted questions. that people sent prior to joining the program. I don't know if anyone's had the chance to look at them, but I can have a look now and read them out if you want. So again, from Dr. Kazi from Handsworth, how do you suggest we check the searches are correct? Should we just check a sample of patients and see why they have been included in the search, or another way? So this is I think in response to what you said earlier, Joe, about practices being able to check to see if anyone unexpected is turning up.
Yes. Yes. So I think that is a good idea, actually. I mean, I think initially what you might see is when you see a list of patients, let's just say, I mean, this hasn't happened, but let's just say you were looking at your 16 to 17-year-olds and you looked at that list of patients. And I'm guessing, again, Ranjan, that you would be able to see a list of patients and you can clearly kind of see the age next to them. So that would be one way of seeing if there was anything. But then, as you say, you might kind of your practice might know some patients and think, well, why are they coming up as in this group? Why are they coming up in this cohort 6 group? It tends to be the cohort 6 group, really. But I don't remember there was anything wrong with them. So then you would do your, again, and Ranjan, correct me if I've got the terminology wrong, but you would do a check patient function. So you'd be able to see why that person has come up in the SystmOne search.
You can do, or you could just browse on the patient list and just look into the coding.
Okay. Okay, thank you. Keith, any more questions?
Not in the no, I can't see any in either our training account or in the chat.
And any more questions from any of our attendees?
Sorry, can I ask? What are the common clinical errors that you kind of come across in the searches? So you mentioned about you've excluded pregnancy anyway, but what sort of issues do you commonly come across that we need to keep an eye out for in cohort 6 specifically?
Just to say, excluding pregnancy, we've excluded them just from the list. They're not excluded from the cohort, just to make that very clear. So in cohort 6, you will see pregnant women rather, but they've just been excluded from your from the list that you would send to AccuBook because they're just a slightly different pathway.
Yeah, no, I understand that. Yeah.
Okay, great. Well, then one of the other things that did come up actually that we're still looking into was that a practice actually did flag up that somebody had been identified, for example, that they had a post-concussion syndrome. So post-concussion syndrome when they were much younger, so they might have fallen off their bike and had a post-concussion. And that this was flagged up because the practice could easily see it was somebody young. They didn't think there was anything wrong with them, so they checked the patient and they found post-concussion syndrome. And what had happened in the coding tree, this wasn't actually really an error in the search. It was part of the coding tree, and the coding tree, this was an EMIS problem actually, so I don't know if it would affect SystmOne, but so what had happened in the coding tree was that post-concussion syndrome had sat under dementia top level, and so that's why this person was picked up. So for us, it would be very difficult actually to find that in a search. It would only be from the practice, actually seeing that, but then we can then go back into the search, exclude them, and then we'd be able to quickly update that search. Is that what you're meaning?
Yeah, just sort of examples of things to look out for. We had a lot of patients with allergies, hay fever and other allergies that seemed to somehow come up in the search under the immunosuppressed tree somehow.
Right.
And also psoriasis patients came up, even though they were not on immunosuppressants. So yeah, it's just examples like that and why that might have come about.
Yes, I suspect that is to do with, the coding and where it's sitting in the kind of, the structure. And that is the sort of things that we'd like to hear back about, actually.
Could I just confirm? So opticians and dentists, do they have to go through their employers for the vaccine? Because we had a lot obviously contact us saying their a dentist or they're an optician, and when can they get their vaccine? So should they be going to their employers, or should they be coming to us as a patient? But obviously they work in the healthcare.
My understanding is that it was the employer's responsibility.
Right, okay.
Yeah, so if they work for Specsavers, it's Specsavers' job to make sure they're vaccinated before they can start, bringing in customers to have eye tests.
Sure. Yeah. Okay. Brilliant. Thank you.
Any last questions?
I think just to flag up, Joe, there are going to be a number of updates, because we are receiving lots of queries now, particularly in this cohort where there's all of these different clinical conditions. So I'm in the middle of looking at conversations around gestational diabetes and about carers who carers without any other health conditions. So unfortunately, it's never a black and white thing with these groups of patients, and that's why I think it's, as you said, it's really important to stress to the practices, if they flag up anything that they spotted that doesn't make sense, to let us know straight away.
Yeah, so that'd be great. So I suppose we're working with you, to get this, to get all these resources, so that they work for you as well. Okay, well, many thanks, as I said, for attending this webinar, and please do contact us if you've got other questions or think of something actually that you didn't think now, but it comes to you later. Please email us and contact us. We'd be very pleased to hear from you all. So, yes, many thanks for your attendance.